All right, welcome everyone. Oh my gosh. So if this is not your first time, then you likely know that this is something we host every month. And normally our Moving with MS series is live, but I had my very first baby in March. And so we were playing a recording for the March and April session. So this is our first one back. This is actually the first live event, if you will, that I've done since coming back from maternity leave. And I absolutely love giving this presentation and just working with MS Views and News for these support groups. So welcome. If you are brand new and this is your first time joining us, a special welcome to you. This is something, as I mentioned, that I co-host with MS Views and News, and our supporter is Viatris. And once a month, we come together and we talk about a physical therapy related topic for multiple sclerosis. And they're always recorded, and the recordings are put up on MS Views and News YouTube page, and I can give you guys the link if you ever need that. And today's topic is pain for multiple sclerosis. So we're going to dive into the nitty gritty, the different types of pain, what pain can do to you other than obviously be uncomfortable. There's other things it can cause, and different treatment options for pain as well. And then I have one slide at the end that I really am excited to share with you because it's about what you can do to help manage your pain in the moment, because sometimes it comes on when we don't even expect it to. So that's what we're going to be talking about today. As always, I like to, let me see, I'm going to open up my questions box over here. Say hello in the questions box or chat box if you see that over on your end, and let me know where you're tuning in from. I see Angela. Welcome back, Angela. She says hi from Cary, North Carolina, and happy first Mother's Day. Thank you. Yes, happy Mother's Day to all the moms out there. One thing I want to remind you guys of before we go any further is this is our virtual support group, and I am the one leading it. I'm facilitating it, but I would love to know the things that work for you. I'm going to suggest different recommendations for pain management, but if you've experienced success with something that is not mentioned here, or maybe even if it is something that I've mentioned, please share what you have found works for you. I have found that the other people on our support group calls find that really helpful. So please don't feel like it's just me educating you. You can educate me. You can educate all of us based on your experiences and what you found works for you. Low back pain, apparently arthritis. Yep. I've experienced nerve pain. Yes, pain when walking. Pain, yes, mostly my lower back when I stand or walk for a short distance. Some stretches help a little, but the pain returns quickly. Deb from Melbourne, Florida, welcome. Renee's gabapentin helps with that. Yep. Pain when it gets hot, my body, my legs. Yeah. Okay, you guys are going to learn a lot. We're going to touch on all these things that you are saying. Yes, experiencing trigeminal neuralgia. Yep. In the past, calf spasms relieved by tizanidine. Currently, I randomly have aching toes before falling asleep. I massage with lotion and am able to get to sleep. Very cool. Itching on the sides of ribs. Yep. Bending, I feel pain in my back. Feel have shoes on the area too tight while my feet are bare. Feel maybe pain when shoes are too tight. Yeah, awesome. Okay, so we are going to be touching on pain and sensation. Technically, sensation is different from pain, but I think they go hand in hand. They're one and the same when we talk about different things that we're feeling. And so I wanted to include it on today's talk. So pain and sensation in multiple sclerosis. And if you don't know who I am, my name is Dr. Gretchen Hawley. I'm a physical therapist and a multiple sclerosis certified specialist, and I specialize in helping people with multiple sclerosis improve your daily activities, make things feel easier, less cumbersome, and with tonight's chat, also with less pain. All right, so as you can see just from what I've called out from those of you participating in the chat, Pain is very common, unfortunately, with multiple sclerosis. So 2/3 of people with MS have some level of pain, and over half of those are affected by chronic pain at some point within their MS journey. I do also want to touch on a fact that I learned when I was in physical therapy school, which is that at some point in everyone's life, MS or not, 80% of people will experience some form of low back pain. So pain in general is extremely common, but it happens to also be a symptom of multiple sclerosis. And there's lots of different types of pain when it comes to MS. We're going to go through most of them, but I think it's important to know that it is common. But with that said, it's treated differently than just aches and pains that everyone gets. And even the 80% of people without MS that will also experience pain, it's different from that. And you'll know, a bunch of you guys have said in the chat, it's itching or burning. It's these words that people without MS wouldn't necessarily use to describe their pain. Clarifying, I have bare feet, but my feet feel like I have shoes on. Gotcha, that are too tight. So that compression that's what I would call that. So we're gonna get in, I have several slides on the different types of pain, but the first two things that are really important to understand is acute versus chronic. And this is important to understand because it's caused from different things typically, and it would often require different forms of treatment. So acute pain is often sudden and inconsistent. So this is something that doesn't necessarily have a pattern to it, and you don't have pain all the time. So an example might be if you had an injury, or someone said when they're bending over they have pain. That's a type of acute pain. If you had surgery, you're going to have pain from the surgery. It might be consistent for a while, but then it goes away, or at least lessens. So it's not always consistent. If you have an illness or a trauma, if you stubbed your toe, even if something like if you have a pinched nerve, that can cause intermittent pain. So all of that is more acute pain. Chronic pain, and this is the type that is often more associated with multiple sclerosis, chronic pain is often consistent and long lasting. Some people with chronic pain will say it never goes away. It might fluctuate if we're rating our pain on a scale of 0 to 10. If 10 is the worst and 0 is no pain at all, there might be times where it's 10. There might be times when it's 6 or 5, or even a 2 or 3, and then it goes back to a 7, but it never goes away. It's always there. That is more of the consistent pain and long lasting. This can be caused and or worsened by external factors, so by stress or anxiety. And I feel like that's a real bummer because so many of us have stress throughout our day. Just like even without MS, life can be stressful. And then we add MS on top of that, and that can make chronic pain worse. So as you can imagine, for chronic pain, one piece of the treatment is likely going to be some form of stress management or anxiety management. I see Krista joined us too. Welcome, Krista. So moving on to different types of pain, allodynia is one type, and this is where something that is a light touch feels painful. So this is something that shouldn't cause pain. For example, you might go to shake someone's hand, and normally, assuming it's not someone who's like aggressively shaking your hand, which we all know some people who do that, if it's just a regular handshake, normally that's a light touch, and that should not cause pain. But if you have allodynia, it does cause pain. Or even if you're just putting your hair behind your ear, touching your hair, that light touch causes pain even though it shouldn't. That's allodynia. Paresthesia. This is a phrase that I personally feel like gets thrown around a lot. If someone has any type of numbness, tingling, burning, itching, people just say, oh, I have paresthesia. And that might be true, but paresthesia specifically is normally an annoying, unusual sensation, so like tingling or numbness. and it can be triggered by something, or it can happen spontaneously. So paresthesia could be triggered by something. A great example that we all get, MS or not, could be a quick thing like you hit your funny bone and you get that instant sense of that tingling. That's a very minor example of what a paresthesia might be. If you've ever had a pinched nerve in your neck or anywhere in your spine, low back, and you felt numbness or tingling going down your arm or your leg, that more often than not is paresthesia. Dysesthesia is different. This is more intense, sometimes painful feeling, which happens spontaneously. So paresthesia, again, it's usually annoying, unusual, but you wouldn't call it pain. This would be something where if I said, I'm going to call on someone saying, if I said, Krista, what level is your pain on a scale of 0 to 10? You would say, well, it's not pain, but it's just more annoying, or it's more this tingling or more numbness. You wouldn't rate it as pain. Whereas dysesthesia, you might actually say that it's painful. It might still be a numbness or a tingling, but it's so tingling that it's painful. So that's the big difference between those two. Neuralgia. So neuralgia is an intermittent shock-like pain, and it follows the path of a nerve. And so I believe someone earlier in the chat said that you have trigeminal neuralgia. So trigeminal neuralgia is when you have this shock-like pain in your face. And usually it's the jaw, usually it's one side versus the other. Usually it's not both sides at the same time, but it follows the path of the trigeminal nerve, which goes to our jaw. Lhermitz sign is a type of pain that is a form of neuralgia. It is a shock-like pain that goes down your spine when you look down. So it's actually caused by neck movement, so movement in your body. It's specifically when you look down, you get that shock-like pain that goes down your spine. For some people, it goes down really far. For some people, it just goes down to your neck and then it stops there. But those are different types of shock-like pain. Intermittent, it comes and goes. That is under the branch of neuralgia. Optic neuritis, I'm curious, let me know in the chat if you've had optic neuritis. Optic neuritis is one of the most common forms of pain associated with multiple sclerosis. And oftentimes it is the first symptom that someone might experience before their MS diagnosis. Optic neuritis is eye pain that worsens with eye movement. And so I'm just looking at you guys right now, but let's just say my eyes are really wandering all over the place. I would get pain with moving my eyes. So that, of course, is not going to be very comfortable, but it often feels, from what people who have experienced this will say, it feels like a dull ache behind the eye. So typically this isn't associated with intense pain or stabbing pain. It's more of a dull ache or minor pain behind the eye. I'm just going to see in the chat if anyone said that they've had it. This can sometimes, not always, sometimes be associated as well with vision loss in one or both eyes. Usually, I would say 99% of the time it's one eye, and 99% of the time you will fully recover from it. Sometimes it's partially, but for the most part it's full recovery. Okay, I see Felicia says yes, Renee says yes, optic neuritis is very painful. There you go. I have optic neuritis that doesn't cause a sharp pain, but does make vision dull or fuzzy. Yeah, so as you can see, even just from these last two participants, it's very different. So Renee does have very severe pain with it. Rena, if I'm pronouncing your name correctly, it's not sharp, but it's more that dull. Okay, and then the next two actually are what I would consider more orthopedic pain. So orthopedic pain is when you have pain from an orthopedic reason, and basically that just means it's not necessarily MS related. It is related to muscle and or bone. So a muscle spasm or spasticity feels like I think I meant to say tight muscles. So if it's a little bit, it might be a light muscle tightness, but spasticity can range all the way to your muscle is so tight that it is not letting go and it's actually preventing you from moving. For example, you cannot bend your knee, or you cannot straighten your knee or your elbow. So it can happen to any muscle, but it can feel like just a little tightness or a lot of tightness. Spasms will sometimes let go. We might feel like it's flinching a little bit. So it can tighten, release, tighten, release. Musculoskeletal pain, this often feels like muscle soreness, or what might imagine we would feel after an injury. So again, both of those muscle spasms, musculoskeletal pain can happen even without MS. Spasticity, that more intense level of pain, of muscle tightness, is more associated with multiple sclerosis. The light tightness is more of the muscle spasm. I'm curious, actually I'm going to go back for a second. Curious, do you have spasticity? And we have had, if you are new, or even if you're newer, you might not know this, but we actually have had a presentation on spasticity in the past. I think we have another one coming up within the next few months as well. So watch the recording for that, and or make sure you tune in for our next one. Barbara says, definitely extreme muscle spasm and spasticity on my right leg. Yeah, so an interesting thing with most MS symptoms is that most of the time, any symptom, of course, we're talking about pain and sensations tonight, but most of the time that a symptom will occur on one side of the body, not both. Or if it is both sides, it will occur on one side more so than the other. It usually is not equal levels on both sides. Kanita says, with my optic neuritis, one eye would not move to one side. Yeah, that makes sense. Barbara, spasticity. Rena, I am spastic. Yeah, spasticity, I would say, is one of the most common symptoms that the clients that I work with have. Weakness would for sure be number one. Balance would be up there, but spasticity for sure, I would say, is in top 3. Yes, my spasticity gets better after I have my infusion. Yeah, that's one way you'll know if it's MS related, is if you have your infusion and a symptom gets better. Lori, yes, spasticity in the left leg. Yeah, super common. Okay. All right. So types of pain and sensation. So this is more of the sensation type, whereas the majority of the previous slides were more of types of pain. These are more sensations. And so it's things like burning, pins and needles, numbness, tingling, crawling, tightness, electric shock, stabbing, shooting, MS hug, phantom pain. I should add itching to this list because someone here tonight said that. So anything that you can think of that just feels weird, that would go on this list. And it is a symptom of MS. I want you to know that, because so often people will think they're crazy. I can't tell you how many clients with multiple sclerosis I've worked with in person and virtually who will say that they have this symptom almost in passing. Like it will just pop up that like, oh, I have this crawling sensation in my hand, but what's a bigger deal is my walking. And of course we focus on walking, but it's nothing to brush off. There's actually things that you can do for pain and sensation. And so if you're experiencing anything we've talked about so far, just know that it could be MS related and there are things that you can do for it. So why? I am someone, I don't know if you're this way, but I'm someone who loves to know the why behind why something is happening, especially when it comes to multiple sclerosis. It's easier, can be easier in the orthopedic or musculoskeletal world, where it's easy to know why we're experiencing pain. We fell on our knee, so our knee hurts. But what about if you didn't fall on your knee and you're having knee pain? Excuse me, or what if you didn't do anything and your hand is going numb, or your foot feels like there's compression around it, as someone earlier said? Why is that happening? And the reason is typically due to damage in the spinal cord. And not only that, so your brain cannot interpret the sensation. So you might be feeling something on your foot. Maybe I'm just going to go with the example of if let's say you're wearing a shoe, but it's a light shoe. It's not on very tight, it's just loosely on your foot, but you feel like it is pressure, like it is squeezing you so hard. Your brain can sense that it feels the sensation of a shoe around you, but it can't interpret it. It doesn't make sense to your brain that that's what this is. So it tries to relate it to something that you've already felt or experienced in the past, because you already know how that feels. So you might know what it feels like if someone were to physically squeeze your foot. So your brain is going to associate this sensation with, oh, it's something squeezing my foot. And it's wrong, that's not accurate, but your brain doesn't know how to interpret it, which seems silly because logically, this doesn't make sense. Logically, we could look down and see, what the heck, I'm wearing a flip-flop. Why does it feel like my whole foot is squeezed? But the signals from your spinal cord to these muscles and to your brain, they're misinterpreting the information. So there's in some cases, in most cases, there's no actual damage to the part of your body that you're feeling this sensory change. So another example might be, let's do something with the hand. Like I might have this pen, I might touch this pen and it feels hot or it feels sharp, especially if I'm touching, what's this? I can't think of what this part is called, but this part right here, it is a little bit sharper. I wouldn't ever say it's sharp, but it's sharper than this smooth part of the pen. And so my brain might not understand that I'm touching a pen. It might feel the very mild sharpness of this and feel like I'm touching a pin, and it might hurt like I'm touching a pin, and it feels like I'm touching pins and needles. So there's no actual damage. This is not damaging my skin. I'm not actually touching a pin, but my brain is not getting the appropriate message, and it's just associating it with something it might know what it already feels like. So no actual damage to that body part. The damage is in the nerve that reports to the brain from that damaged area. Let me know if that makes sense. It can be kind of tricky to understand because, again, logically, we can see that my hand is touching a pen. It's not touching anything that is sharp, but it feels sharp. So hopefully that makes sense. And that's true for all the different types of pain that we talked about, not just the two examples I just gave. Okay, so why does this matter? Of course this matters because it's uncomfortable for you to feel, but I wanted to just point out that it goes beyond that. It goes beyond just what you're feeling. Most of the time, if you're feeling pain, it affects you in some way. So for example, if you have numbness in your feet, or even the compression, the tightness, the tingling, burning, pins and needles, anything, any abnormal sensation in your feet, oftentimes will cause difficulty walking. And this is another perfect example. So often I'll be working with my clients and they'll tell me their big goal is to improve their walking. And we talk about all these exercises that they can be doing for strengthening and balance and walking. And then I'll ask the question of, how's the sensation in your feet? And they'll say something like, oh, it's fine, it's a little numb, but my strength is so weak, like I'm really weak in my legs. But if you can't feel your feet properly because of numbness or burning or tingling, whatever it is, if you can't feel your feet properly, that 100% is going to affect your walking. So even if you get full leg strength and full balance, yes, your walking is going to improve, but it's not going to improve as great as you might think because you still can't feel where your feet are. In order to place your foot where you want it to go, you need to be able to feel the ground. And so sensation-based exercises must be part of your program if you're experiencing that. The MS hug is something I mentioned earlier, but we didn't really get into. MS hug is a type of pain and type of spasticity that feels like a tight sensation around your torso. And if you experience this, let us know in the chat to know what it feels like for you. Most of the time, it's anywhere around your belly to your chest. And I've even had some of my patients say that they feel it more in their throat. And it can sometimes, if it's around their diaphragm, make breathing feel difficult. It can sometimes make talking or swallowing feel difficult. And it's similar to all pain, can really range in terms of intensity. It can be super intense or pretty mild. Pins and needles in the hand. So oftentimes pins and needles or numbness or any type of pain in the hand can lead to weakness because you won't use that hand as much, because it makes the sensation or pain that you're feeling even worse. So then your hand gets weaker because you're not using it. So weakness is a big one. And then also dropping items, dropping yogurt cups, dropping actual cups or glasses or mugs, dropping a pen, dropping things is a big issue when you have pain in your hands. And then hot or cold. This can be really tricky if you are, how do I want to phrase this? If you're trying to heal an injury maybe, or if your muscles are sore and you know, like if you just ice them or if you just heat them for maybe 20 minutes, you'll feel better. If you can't sense hot or cold, you can get a cold burn, an ice burn, or obviously from hot temperatures, a burn from it being too warm, because you can't sense what the temperature is. You can't sense that it's getting too hot, or you can't sense that it's getting too cold. So you leave it on too long, especially if it's something that's like a heating pad where it's plugged in and it will not lessen. It just stays the same level. With something like an ice pack, it can still happen, but the more your skin warms it, it's going to warm up. It's not going to stay cold the whole time. So hot cold is another one that can be very tricky if you're using it as a form of symptom relief. It makes sense to me. That explains a lot of sensations I have. Good. Cold water before shower, before the shower heats up, will make legs buckle. Yeah. So these are just a few implications, a few ways that some of these pain and sensation symptoms could affect you, but there's lots of ways. But I want you to start thinking about how it affects you. You probably know right away how it affects you, but understand that the way that it affects you can be a guide of what exercises or what symptom management techniques you can implement. This is a good question. How does intention tremor relate to pain? I drop things because my fingers won't stay closed. Tremors are really tricky because I like to separate it in two different categories. So there's tremors that you can have that are related to weakness from neural pathway weakness and muscle weakness. And then there's tremors that, are not associated with the muscles, and it's more so just misfiring of your signals. So if it's related, so the question is, how does intention tremor relate to pain? I drop things. So intention tremor is more so if you're about to reach for something, like I've got my water here. If I'm going to reach for my water, I might start to tremor as soon as I get to it, or once I get there, then I start shaking like crazy. So if it's muscular related and therefore it's happening because of weakness, like maybe the reason that you're shaking is because you don't have enough strength. I don't know if I'm assuming most people have experienced this. Back in the day, do you guys know what Pure Barre is? Pure Barre is a type of class. It's kind of like a Pilates class. So I was taking a Pilates class, we'll call it that, and the whole point was to get to the point where your muscles are shaking. So like you're holding a squat for a long time, so much so that your muscles are fatiguing and shaking. And in that class, that was the goal. But that can happen in anything. In a much more mild example, if this is too heavy for me, even if it only weighs 1 pound or maybe even less, if my hand doesn't have the strength, I'm going to start shaking that. And so there's exercises that you can do, which, just checking on the time, there's exercises that you can do for that to build up your strength, and then the tremor theoretically would improve. However, a different type of tremor, which is a little bit trickier from a physical therapy standpoint to treat, is if the reason that you're having the tremor is due to misfiring, missignaling of your neural pathways. That, I believe there are some medications that might be able to help with that, but the only exercise that potentially could help with that would be to work on coordination. Is the tremor happening, especially with something like intention tremor, where you're reaching to touch something or grab something and it gets worse? You might be able to improve your coordination. And so for that, let me change the angle here. Okay, so I've got my water bottle here. Let's say every time I reach to touch my water bottle, I start shaking. I would try to get closer, make it really easy, and try to touch it and relax. And I'm only, can you even see, I'm only just a few inches away. Do I still shake when I'm that far away? Hopefully it's not. Hopefully it's not as bad as if you're here and reaching that far. So if that's okay, then I'm going to come back a little bit further. Can I reach there for it? If that's okay, come back further. And you're doing this as an exercise. So wherever it's too challenging and you start noticing the shake, come a little closer so that doesn't happen, and you're reaching as an exercise. So it's a coordination type exercise. And you want to reach for something big. Typically, the smaller the thing is that you're reaching, like if I was trying to just open this top, that's my shaking would be worse if I'm going to try to open this versus if I'm going to try to twist to open. So the bigger the thing that you're touching, theoretically, the less the tremor is. So when you're doing this as an exercise, practice touching bigger things, not going for small things. Let's see. Intention tremors happen when I am trying to sign things or type things. Yep. Yeah, right. And that's the perfect example. Okay, so it's happening when you're going to type things. Look how small those letters are on your keyboard. Talk about coordination and tiny things. So a way that you could practice this could be to take one finger and touch the G and then back. One finger, touch the H and back. If you're noticing bad tremor, instead of bringing your finger back here every time, you won't be able to see this, but keep it close. Touch the G and then lightly take it a few centimeters away from the G, and then touch the G a few centimeters away. Touch the G a few centimeters away. If that's still too tricky, then I have this coaster right here. So I'm just going to try to touch the coaster. So much bigger than the G on your keyboard right there. So I'm going to try to just touch anywhere, and your tremor probably is going to be better than if you're trying to touch specifically just this blue part. So I don't want to get too far into it because we still have more to go on, but that's an example of something that you could do. Tensional tremors happen more at the end of the day. That is normal. It's typically going to be worse with stress and fatigue. What would you do to strengthen if one leg shakes when standing? So again, it'd be important to determine why the leg is shaking. Is it shaking due to lack of endurance? Like you can stand for 3 minutes, but not 4. That would likely indicate more of a poor endurance situation where you've got strength to a certain point, but you don't have it for as long as you need it. So then you'd want to work more on endurance strengthening. Again, I do think we have one of our sessions coming up is going to be touching on that, but that's more endurance. Whereas if it's always shaking, it still could be endurance or just your regular weakness. If you stand up for any amount of time, even 2 seconds, and it's always shaking, it could be really weak, and so we'd work on strengthening exercises, or it could be the misfiring of the neural pathways. And so that is either going to be a form of medication or a specific way of approaching the strengthening based exercises where you're not just putting 50% weight through each leg right away, you slowly work up to that. Thank you. The intention tremor occurs when reaching for something in a cabinet. Yeah, Yeah. And so if you wanted to potentially improve that, it doesn't always work, but if you wanted to try to improve that, try to reach for something at a different angle. Maybe it happens when you're reaching in a cabinet that's up here, but it doesn't happen when you're reaching down here. Or even if it does, maybe practice reaching for something big. If you're trying to reach, I don't have a mug up here, but if you're, pretend this is a mug and it's got like a handle. If you're trying to reach for a handle, you're probably going to be much more shaky and tremoring, more so than if you were reaching just for this big old water bottle, because it's a bigger thing. You don't have to worry about how specific your hand is when you touch it. How can you help someone with really bad numbness, tingling? Yeah, so we're going to get into some treatments in a second. It helps me to look, ooh, I like that tip. It helps me to look past what I'm trying to touch. That's cool. Barbara, I wonder if you could try that with reaching into the cabinet. Very cool. Thanks for sharing. So treatments, and this is all of these treatments that we're talking about it's not an all-inclusive list, it's just the most common ones. But if something is not mentioned, feel free to mention it in the chat box. Again, this is really helpful for other people to just see what works for someone who's also experiencing this. So typical treatments when it comes to medications, I almost said meditations, when it comes to medications are things like Botox. Botox can help relax muscles. Tight muscles, which can be caused from MS, can cause so many of the types of pain that we talked about. It can cause paresthesia, dysesthesia, the shock-like pain from pinched nerves. It can cause so many of them. And sometimes it's really hard to relax your muscles that just stretching isn't enough. And so Botox is something that some people can have, or baclofen is another common one. Usually you'd hear of those two options for things like spasticity. Pulsed magnetic field is another thing. It's kind of, I like to think of it as like a form of electrical stimulation. Gabapentin, someone mentioned earlier, that is another one, another medication that can be helpful for pain. I know patients who have taken it for pain. I know patients who have taken it for the numbness or tingling, and it's helped for both types. It's not just for one specific type of pain. Amitriptyline, duloxetine, pregabalin, and antidepressants can also be helpful. Sometimes it's a combination, sometimes it's none of these. So these are just some of the most common ones. As always, it's going to be important that you talk to your neurologist about which one of these might be best for you. More likely than not, they will have one that they'd want to start you on first, see how it goes. If it doesn't work, then they might try something else. For example, baclofen is an oral medication and it affects you systemically, meaning it's going to relax all of your muscles, not just your foot muscles or your knee muscles. But Botox is given via, I can't think of the word, injection, and it's into a specific muscle group or muscle rather. So that is more localized. You can get Botox in just your knee muscles and it won't affect the rest of your body. But usually you'll start with baclofen before going to something like Botox. There's no medications that have been shown to relieve numbness. There are other things you can do though. So other treatments, occupational therapy is often the type of therapy that will help with exercises, of course, it's still therapy, but also splinting. So if you notice that maybe you get really tight hand muscles, specifically on your palm, and your fingers start to close and it's hard to open. The hard to open is more of a weakness thing, but the closing can be a tight muscle thing. And so occupational therapy can be, they can prescribe splints and work with you to get a splint that opens your hand more. And then your pain theoretically would lessen as well. So they can work on splinting with the hand, the shoulder, the elbow, even lower body as well. Physical therapy can help with exercises, of course. You know, if there's Tight muscle stretching is also something, electrical stimulation. There's lots of different forms of treatments that we can do. But the one that I want to spend the most time on is desensitization. So I've talked about this with you guys before, but it's always worth mentioning, especially during this topic. Desensitization is we'll call it an exercise where you are desensitizing a specific body part or area. So let's say that your hand, it's easiest because you can see my hand. Let's say your hand is numb or tingling, any of those, pain on this side, or maybe it's both sides, doesn't really matter. Desensitization means you find something, let's say this pen, that bothers this hand. It makes the numbness worse. Or maybe not worse, but you notice it, like here, just having my hand here, I don't feel anything. But if I touch it, I feel the numbness or the tingling or whatever it is. So I'm going to take this pen and I'm just going to touch it. You can pat it. There's no specifics here. Just touch the thing that's bothersome, that causes the symptom. Touch it to that area. And the idea is you would do this for maybe 3 to 5 minutes or so. Theoretically, what will happen is eventually you will start to feel like, oh, this doesn't bother me anymore. And for some people, that happens in the same session. I had a patient come to me one time. She was almost in tears saying, I can't do physical therapy today because my legs are burning. They hurt so bad. And so I'll share the strategy we did with her. But within that session, within probably 10 minutes, she was noticing an improvement. So we did it 10 minutes more. And by the time she left after a 30-minute session, she was feeling much better. So sometimes right away it'll work. Other times it might take a few days, weeks, or even months. But once it feels better, once you feel like, oh, this doesn't bother me anymore, then you find something else. What do I have? I've got I happen to have my book, the Missing Link book. So maybe I tried to use something sharp, like the corner of a book. Now, obviously that's not actually sharp, but it might feel sharp and it might cause me to feel uncomfortable, that abnormal sensation might come back. So I'm just gonna rub it around, tap it, and you can use so many things. These are just things I happen to have here. This sweater that I'm wearing right now is like a waffle knit. That's gonna feel different than cotton or cashmere. So I could rub my hand on something like that. If you have a hairbrush, one of my favorite things, and what I actually used with my patient I was just talking to you about who had burning in her legs, is rice, dried rice. You can put it in a bucket or you can put it in a Ziploc bag. It doesn't matter where you put it, big Ziploc container. Put a bunch of dried rice in there, maybe even some dried corn, some dried lentils, things that have a smooth but also a sharp edge. And then you're gonna put your hand in or put your feet in and just move it around. Same concept, just put it in, touch it, move it. Eventually, that should lessen the sensation that you're feeling. Now, initially, it's gonna make it worse, usually. So you'll be touching it and it's gonna feel like, this is not comfortable. This is making my tingling worse or my numbness worse. But it should start to lessen. So know that if it does make it worse, that's okay, as long as it's not causing any harm. Then it's typically okay to keep going, wait it out, see if you can do it for a few more minutes. If not, then choose something else. Choose a different object, a different item. You could even start with something as simple and as light and airy as a cotton ball and see how that goes, and then work your way up to other textures. Okay. Can antidepressants help if mood isn't a problem? I'd have to look at the research on that. So often, as I mentioned earlier, anxiety, depression, overwhelm, stress makes symptoms worse, especially when it comes to pain. So I have a feeling that's probably why most researchers say that antidepressants can help, but I'd have to look into if there's something in them that can help with pain, even if you don't have a mood disorder or anxiety, depression, something like that. That's a good question. And then exercise. So exercise is always going to be helpful. So with things even with things like pain, especially because when it comes to pain, we start to overcompensate without even realizing it. Meaning, if you have poor sensation or pain on one side of one leg, you're probably not going to put as much body weight on that side because it makes it uncomfortable. It maybe makes the pain or sensation worse. So then it's going to get weaker, and then that's going to affect your walking. And so if we can work on exercises for strengthening that side and maybe balance exercises, then that can help. Usually that is in combination with the desensitization strategies. Massage can sometimes be helpful. Heat or cold therapy, again, if you have abnormal sensation of temperature, you wouldn't want to use heat or cold therapy, but as long as you don't, then that's fine. And then compression sleeves can sometimes be helpful as well. Not if you're having the compression symptom, like the sensation of compression when nothing's actually compressing that area, but otherwise compression sleeves can help reduce pain for several types of pain. What about adding sensitization? When I touch my left hand, I can hardly feel it. Yeah, absolutely. Yeah, so if you can hardly feel it, that's more of that numbness. That I would categorize that under the numbness. And it's the same strategies that we were talking about with, I started with my pen and then moved on to the book, or you could use your jeans. I have a coaster here that's a different material. You're really just looking for different materials, different textures. So of course, can't not talk about the types of treatments about reducing stress. And this is going to be so different for each person. I purposely didn't put meditation on here because for some people, I would say for the majority of people that I know, meditation stresses them out, and the whole point of meditation is to not be stressed, and they always feel like they're doing it wrong. And so if meditation stresses you out, that's not going to be something that's going to help reduce your pain. If you can meditate and it makes you feel better, that absolutely can go on your list of treatments. But reducing your stress in some way, I love reducing stress by, well, two things. One, coloring in a coloring book, I find really soothing. But another thing is I like to notice my surroundings. And so even right now, if I were feeling stressed, what I would do, and you guys can't see my room here, but what I would do, if I look up here, I have a picture that one of my friends is a photographer, and she took pictures of cows in the pasture. And I have one of those cows here. And I would specifically look at certain things on this picture. I wouldn't just observe, there's the picture of the cow. I'm going to say, there is the cow, and I'm just talking out loud. Normally I wouldn't talk about it, I would just observe these things. But the cow has like a caramel color fur, but it's got long shaggy hair up here that's more blonde, and it's got really, really dark brown eyes, and the eyes are pretty big. There's actually a fly sitting on one of its horns. It's got two horns that come out to the side. There's some bushes in the background and it's blurred, but you can still tell that they're green. And so I get really specific of what exactly am I looking at, or what things do I notice around me? So we can just distract ourselves and focus elsewhere. I have 3 lights behind me. One is tall and pointing up towards the ceiling. One's looking right at me. If I look outside, what do I see? What do I hear in this moment right now? I can hear a lawnmower. I just heard someone's car door shut. I can hear some birds. Like really focus, what can you hear? So those are types of things that I like to do to help calm myself down, bring myself back in the moment, and it lowers my cortisol levels, it lowers my stress, and that can reduce pain and sensations that you're feeling as well. I wanted to also add, focus on steady breathing, whatever that means for you. For some people, it means belly breathing. For other people, belly breathing just stresses them out even more because they can't get it. But just focus on your breath and just know there's no expectation. You don't need to focus on your breath being slow and deep. Anytime someone tells me to slow down my breath, I just start noticing that I'm breathing faster, and that stresses me out. And so just don't worry. There's no expectations. Just focus on your breathing. Focus on air coming in and out. It can be through your nose, it can be through your mouth, whatever's more comfortable for you. No expectations, just focus on what your breath is doing, and that can help calm you down as well. Oh, I see. Kanita says coloring stresses me because I can't stay inside the lines. Perfect. So then that would not be a good option for you. You know, it's so individualized. It works wonders for me. If it doesn't work wonders for you or doesn't work at all for you, that's fine. Find something else that you do that you find to be helpful. One tip I just learned was to touch your hands. So you can do this with me now if you want to. So you touch your hands, and right now, this is my left hand. I'm gonna focus on what my left hand is feeling, okay? What my left hand is feeling. So with my right hand, I'm gonna touch it, but I'm trying to focus on what this one feels, not what this one feels. What is this one feeling? As I just touch anywhere and go around. And keep reminding yourself, what is your left hand feeling? Not your right, what's your left hand feeling? And now, and we do that for probably a minute or so, maybe even 30 seconds. And then same thing, but what is your right hand feeling? Is it any different? Maybe you use the, just switch hands. Well, still, what is your right hand feeling as your left hand does this? And it requires so much focus, I find, to focus on, okay, just this one hand, not what does it feel like overall, like it just feels like I'm touching myself. No, what does it feel like on this one hand? And it requires more focus that can calm everything down and make you feel safe. And when you feel safe, pain is better. Okay, so I think this is my last slide. I just wanted to touch on what can you do? Because so often, especially with all things when it comes to MS, if things are just random, we didn't do anything to bring on the symptoms, they're just there. But what can you do? The number one thing when it comes to pain, well, yeah, let's start there. The number one thing when it comes to pain and sensations is becoming aware of your triggers. If there are any, there might not be, but are there any triggers? Does your pain or sensation worsen if your core temperature is warming up too much, if it's hot outside or with a hot shower, if your core temperature is dropping too much, if it's cold outside or a cold shower, cold temperatures, if you're stressed, if you're actively exercising or maybe after exercise, any sexual issues, does that make anything worse? If you're using something, if you're using a pen, a cup, a fork, if you're sitting in a chair, if these is just a small list, but what are your triggers? Is there anything? Maybe it's a UTI or a cold or a flu. Is there anything that makes your symptoms worse? If so, that is directly something that you can focus on improving. If you know that hot, being warm or a warm shower, hot temperature outside makes your pain or sensation worse, then we can focus on taking cooler showers. We can focus on sipping cold water. We can focus on wearing a cooling tech. We can focus on things that can reduce that trigger, ideally before it even happens. And so if you have some triggers, that's a great first start. The next step would be, and/or this step can happen at the same time, but to talk to your physical therapist, occupational therapist, or neurologist, or maybe all three of us, and see, okay, help me figure out why this is happening. And if there isn't a reason it's happening, are there exercises? We go back to the treatment slides. Are there exercises I can be doing? Would e-stim be helpful? What about stretching or massage? What about a medication? Usually medication's not something we go to right away, but maybe it is something that in what you're experiencing, that is what would be the most helpful. So start with your triggers, because that's something that you should know, but also your doctors should be aware of. And it's, if you do have triggers, it's something that can help right away, typically, versus having to wait for your exercises to kick in or wait for medication to kick in. Okay, so what time we got here? Oh, right on the dot. So that's all I have today. I'm gonna see if you guys have any further questions. It does look like some things are coming in. But as always, if you ever need to reach out to me, this is my email. My website, missinglink.com, has all the ways that we can work together. I have a Facebook page, an Instagram page, a podcast, a YouTube. I keep forgetting to put this on here, but of course my book as well called The Missing Link. So that is where you can find me. All right, and then I'm just going to see if you guys have any questions in the chat. Sexual intimacy hurts. Yep. That's pretty common. And if that, let me just touch on this. I am not a pelvic floor physical therapist. There are specialized pelvic floor physical therapists. If sexual intimacy hurts, if there's any pelvic floor sensations, pain, anything, male or female, please seek out a pelvic floor physical therapist. It's not talked about often enough. Most people don't even know that they exist, and they can be so helpful. Heat, humidity, barometric pressure drops. If it drops, it cripples me. Yeah, I was just talking to a client today about seasonal changes. Sometimes, so the majority of the time, if you have heat or temperature sensitivity, is to something hot, so heat, humidity, increased barometric pressure, or cold, so coldness, barometric pressure dropping. But sometimes it's just a seasonal change. It might not even be hot, but if it's winter and you're used to it being cold, and now all of a sudden it's a little bit warmer, that can throw your MS symptoms crazy. Or vice versa. If it's just starting to get chillier, even if you typically do better in the cold, that can make your symptoms worse because your body wasn't used to that. So seasonal changes too. Lori says, thank you, Dr. Gretchen. So good to see you again. It's so good to be back. Congratulations. Happy post-Mother's Day. Thank you, Mary Lou. Rena says, thank you. Next month's topic. Good question. Shoot, I just looked that up. Do I remember what it is? Let me quickly see if I can find it again. Here we go. June is hand and arm strengthening. And usually when we talk about that, tremors always come up. So we'll probably touch again on tremors, but hand and arm strengthening. And we always meet the second Monday of the month too. Awesome. All right. Well, I don't see any other questions coming in, and I do see we're slightly over time. Thanks so much for hanging out with me and staying for the few extra minutes. But that's where we'll end it for today. Again, reach out if you need anything at all. If you have any topics you want us to touch on, let us know. We'll see if we can work them into some of our future months. And I will see you next month in June. Have a good night, everyone.